Now, Ramadan is just knocking at our doors. How do we, as Muslims, how do we put ourselves in readiness for the month of Ramadan? I mean, looking at health-wise.
Yeah. Yeah, I think this is a very important question. We know in the Quran, as our Imams have said, Allah subhanahu wa ta'ala said that when we fast, it's better for us. And whatever Allah subhanahu wa ta'ala said is better for us, meaning there are a lot of spiritual benefit as well as physical and all other benefits that sometimes we cannot even think of. But what we realize is that, especially in our communities, when people start fasting, at the end of fasting, they realize that they start falling sick. Most of this is as a result of we not understanding how our body works. We don't know the sicknesses that we have, the kind of deficiencies that we are suffering from, and more especially how we even do our suhoor and then the iftar. We take in everything to start the fasting, and then we also take in everything to break the fasting. We put our body tissues under so much stress coupled with the fasting. And at the end of the day, when we end our Ramadan, either the 29 days or 30 days, then we see that certain sicknesses will come. And then people will start mentioning that when you fast, it's normal. When you fall sick, it is never true. So it's important you do early medical checkup pre-Ramadan so that you understand the health state of your body. Because sometimes you can even be experiencing the deficiency, like for instance, you can be lacking vitamin B complexes, notably B12, B6. So you start the fasting, you realize that you feel excessive weakness. It's not normal to you, but you feel some kind of excessive weakness, but you think it's the fasting. So before you realize, you keep on compounding your issue, and that can complicate your health condition. So in a nutshell, what I can say is that we have to seek early health care during this month that we are in, before the Ramadan. We should also start.
Sure that
yes,
you are very ready health-wise for Ramadan.
Yeah.
But Doc, before I go to Madam Mike, let me ask you this question. We know certain categories of people are exempted from fasting of Ramadan. Now, one group of people are the sick people. But somebody will say that, oh, me, I am sick, though I am exempted, but I can't live without fasting. So is it harmful when you do that?
Yeah. When you are sick, it's not for you to determine your sickness.
No.
So if you look at the hadith of the Prophet, I think there's a narration that even the Prophet Muhammad has recommended that whenever you are sick, you should seek help from a professional or expert. So it's not for you to sit home and think that you have ulcer, you have hypertension, you are to seek expert care. So when you are seeking the care from the expert then based on the expert advice, that is the only basis that you can rely your sickness on. Because we know fasting can also help to heal some kind of ailment. So how will you know whether the kind of sickness that you are having is not the type that even the fasting will promote your healing? So that is why it's important to seek care from the experts so that you will be informed whether you are exempted or not. And inshallah, when you seek care from experts that also understand the Islamic point of view of fasting, it really helps us a lot. And someone who doesn't know what fasting really is.
So before I go into the real questions, as a mother, when you begin to anticipate the month of Ramadan, what are some of the issues that you take into consideration, especially looking at the health of the family?
Yes. Of course, Ramadan is always a very important happening in every Muslim family. And I think the most preparation should be first is emotional and spiritual. When you are planning to receive a guest, you first prepare what am I going to do for the guest, how am I going to meet that guest, how ready I am. And so it's very important to prepare yourself emotionally and spiritually, and make sure that you are very ready for this, because there's not only the fasting, there's a lot of ta'at and there's a lot of ibadat that you need to perform during the months of Ramadan. And in terms of food and other things, I personally try to put myself in a mood of a bit of fasting before the fasting, in terms of not thinking too much about food and not being like over concerned about I'm going to eat, because a lot of people fall in this trap that Ramadan becomes all about food. It's rather about how to stop eating, not about what am I going to eat more and more. And we will get more into this. But for me, it's more like thinking more about it and preparing myself and the family that, look, there is something, Ramadan is coming, we need to be ready emotionally, spiritually, and physically for it. And of course, making sure that you are in good health before the fasting. You want to make sure that I don't do things that can affect my health maybe negatively, so that I am ready for the fasting. Because, you know, fasting requires some physical energy and effort as well.
That's great. Now, let me go straight into business. Dr. Muftawu,
Yes.
now, when we say prophetic medicine, what is prophetic medicine? Now, Prophet Sallallahu Alaihi Wasallam, Prophet Muhammad Sallallahu Alaihi Wasallam, had lived over 1,400 years ago, and even more. So do you think that it is relevant in our contemporary times?
Yeah. When we say prophetic medicine, as the name implies, maybe if you can say Prophet Muhammad Sallallahu Alaihi Wasallam medicine. But now when we say prophet, because of how popular Prophet Muhammad is, we are able to just shorten it and say prophetic medicine.
Naam.
The prophetic medicine, in a nutshell, consists of all the narrations, either through the hadith or in the Quran, that the Prophet Muhammad Sallallahu Alaihi Wasallam has taught his ummah regarding how to keep themselves healthy, and then also how to prevent certain sicknesses. So when you look at some of the compilations of the narrations of Prophet regarding health, what we normally say in the Arabic Tibb Nabawi, that's the prophetic medicine. We realize that when you group the hadith, you see that some aspects of the hadith, they are for curative purposes. Then we have others to that are also for preventative purposes. The curative ones are when due to either your negligence or certain things out of your control, you fall sick. What should you do? So when it comes to the preventative aspect, it is what you do that you prevent certain sicknesses. And in prophetic medicine, emphasis is also laid much on the preventative medicine, which includes certain foods that you eat, some of the aspects of your good moral behavior, your relationship with Allah subhanahu wa ta'ala, your eating habits. When you say eating habit, we are not referring to you eating anytime. The Prophet has mentioned in one of the narrations how you should even divide your stomach in 3 portions, imaginary, so that you leave some portion for food, another portion for water, and another portion for air. And then how do you know that where you have reached that 1/3 portion for the food? Usually when you start eating and then you feel like eat more, ideally that is the time you are supposed to stop. But in most cases, even the Muslims, those who even know the hadith and then the Quran, they will eat to the brim, and they cannot even, sometimes they cannot even lie down. So in a nutshell, prophetic medicine is there to help us Muslims and then even the society at large to keep up to speed with our health. And whether it is being practiced still in the modern society, it's still practiced. But the way it's being practiced, because we don't give reference to the prophets, we sometimes think that it's not being practiced. There are most aspects of our life, if you know what the prophets say, you realize that the medical profession, that is what we are even encouraging now. For instance, as I mentioned regarding the eating, eating in moderation.
No.
That is one. And then also, when it comes to the prophet advice on even sleeping, where you should even sleep. Medically, it has been proven that when you sleep on your left, you inhibit proper digestion.
No.
And with time, it can even cause your sugar level to rise. So the advice that the prophet said we should even sleep on our right side is something that we are still encouraging, is still being used. But because we don't give reference to the prophet, we sometimes think it's not being practiced. But largely, because of modern practice and Western medical practice, and then the infiltration of the Western culture, even the Muslims tend to forget about what the prophets say about how they should keep up with their health. And that is one of the things that we make sure that we practice at our facility. Now, my practice as a natural expert, I look at all the prophetic sayings and then try to put it into practice. And so far, it's been doing wonderful for all my clients. Yeah.
Let me come to you, Ajia. I think that it amazes me that as a corporate lady, as a mother and a family woman, you are into various professions. The beautiful mosques we have at KNUST, and then the cantonment police mosques are all part of your handy work.
Thank
May
you.
Allah
Alhamdulillah, it's a
subhanahu wa
blessing.
ta'ala, reward you abundantly.
Alhamdulillah.
But as if that is not enough, now you have ventured into wellness or healthy living and wellness. Now, do you think that your ibadah, religious practices, are actually related to healthy living and then wellness?
Well, interesting question. Thank you very much. You know, health, it has to do with our life. It's with the way we lead our lives. And whatever our profession is, as human beings, we are supposed to first take care of our own health and also, share every good information or every ilm or knowledge that Allah gives you, share it for the good of the humanity. And from this perspective, I see that whatever ilm or whatever knowledge that Allah has given me or resources has Allah given me that I'm able to share with humanity and with the community, whether it is by building a mosque or by setting up a project that is useful for health. I think this is a blessing from Allah that He has allowed me to understand this or to be able to offer these things. So coming back to religious practices, your religion determines your relationship with three aspects of life. Your religion determines your relationship with your Creator, with Allah, and especially Islam has been very explicit and detailed about organizing relationships between the Muslim and his Creator, and between the Muslim and his community, his family and his society. This is second relationship. And then the relationship of the Muslim with his own self, his duties towards his body and his mental, physical setting. So in health also, we consider that physical mental and spiritual aspects of the human being. They are all related. Why are they all related? Because they all affect each other. And that's where also being a Muslim or following a religion as Islam that is complete in terms of all these three aspects of life, in terms telling you how to be spiritually fulfilled, how to be mentally, have positive impact in the society, have positive thoughts, and always adopt and take what is good and what is useful for the society. That has to do with your mental set as a Muslim. And then the physical aspect, we can see that all the ibadat and all the things that Allah has asked us to do, they all have a health aspect of them. How? You know, fasting, for example, he was mentioning. Fasting has a very important health aspect in terms of spiritually connecting with Allah and doing something for Him and knowing that you are rewarded for what you are doing. Mentally, because when you are convinced that you have to stop and you have the discipline, that you have to stop doing this and this for the sake of Allah, that teaches you a lot of mental discipline and also mental inclination for doing good. And the physical aspect of it, which is, you know, you have to stop, or you eat this or you don't eat this. All these things they help you to heal. They help your body heal, they help you heal emotionally and mentally. That's why in Ramadan we feel a little bit more in peace, we feel more, you know, you are not supposed to be stressed, you are supposed to be calm, treat people with the calmness. And that applies to all other things that Allah has put on zikr, prayers. They all have a healing aspect. And if we follow these things very well in terms of khushu', in terms of doing the performing all these things in terms of fasting and prayers well, we will see a very big improvement in our health. So that's my understanding of the relationship of the religion with the health. And
that's
lots
very,
of examples.
That's very elaborate. So going into details, earlier on you mentioned that the Prophet ﷺ had mentioned that every sickness that Allah had created has a remedy.
Yeah.
So can we rely on natural therapies to remedy all those sicknesses?
Yeah, that's very important. And in fact, this this quotation that you said from the Prophet is one of the things that should even guide all Muslims to know that whatever sickness or whatever epidemic that arises, there is definitely a cure for it. So in that hadith, the Prophet refers to every disease, there is a cure for it, unless you don't know about it. You don't know the
You say, seek for medication. For every sickness has a remedy. But arafa man arafahu. Those who have knowledge are experts. No, you can't just wake up according to the Prophet and say you are prescribing natural medication, as a lot of people do. Yes. So the Prophet did emphasize that those who have the knowledge have it. And then those who do not have it, they do not have it, so they should not venture into it. So it needs knowledge and expertise. So that one must be emphasized, because we have a lot of quack practitioners of prophetic medicine who are, in the system, doing all sorts of things. Yesterday, for instance, on another network, I watched something very, very nasty. I don't want to mention it, but I think that this point must be emphasized, that seek medical care, natural or orthodox, from an expert, so that even if the situation gets worse, he can find a way of assisting you to come back to,
Yeah.
I mean, normal situation.
For that is one of the good things about when you are seeking care from an expert. He knows what he can do and what he cannot do at any given point in time.
Especially when there is complication.
Yeah. And back to the question about the natural medicine and what they can do. When you look at even the orthodox medications, majority of the orthodox medication find their constituents or their compounds from a natural source. Some of them they still have to go back to the natural source before they can be able to prepare it. But now most of them, thanks to technology, with the compound, when they are able to isolate from the natural source, they are able to synthesize the compound, a similar one, and they are able to produce the orthodox medications. So natural medicines, there are a lot of natural medicines for every specific illness. Some of the natural medicines can even be used for more than one sickness. For instance, when you come to Ghana, for instance, what is common is moringa. We popularly use it. Some people even have the plant within their in their homes. Some even use it as their fence. It's a very nutritious plant. And then
moringa.
Yes, moringa.
So how do you call it in the Zongos?
Yeah, moringa, the Zongo, they call it jogala or something.
Jogala,
Yeah,
okay.
jogala, yes. So it's a popular plant that, in fact, helps a pregnant woman against malaria. Not only her, it also helps the baby because of the numerous vitamins that it contains. And then apart from that, it's also good for the men. When a man takes it, there is a compound within the leaf that is able, we call it glucosinolate, that is able to even prevent the men from having prostate cancer. So this moringa is very good for this condition. But if you don't know much about it, you will just be abusing it. The same moringa too, when the men also take it, it can also cause them sexual weakness. The same moringa that is able to fight malaria and then prostate cancer. That same moringa too, when you take it overdose, it can lower your testosterone level. And the testosterone is one of the hormones that promote libido, enhances the man's libido. If you take it too much, it can also lower your libido.
I see.
So it will depend on the expertise of the one who is giving you. That will be able to determine the dosage that you need, and then the bioavailability, how much of it will be available within your system, so that you'll be able to get the right benefits from the the natural remedy that you are taking. Yeah.
Okay. So, Doc, one other very important question, I think this question should go to Madam Rada. At your center, apart from using herbs, oil, and other medications, what are other therapies that can be said to be very natural?
At our center at Lotus, we believe that we believe that the body has its ability to reset itself if it is given the right conditions and the right things that it needs. That's why we try to implement all the natural therapies that has been approved in different cultures, and that has, you know, a good effect on the body. For example, we have an Ayurvedic doctor with us. Ayurveda is a medicine that is practiced in India. And I will not go too much into this now, but it is interesting when you compare maybe Ayurvedic medicine to prophetic medicine. We could see that there's a lot of common principles, you know, like encouraging fasting and how the food is your medicine, to be careful about your digestion. You know, Rasulullah said, Al-Ma'idatu baytu da' wal-himyatu khayru dawa. Every sickness starts in the stomach. In Ayurveda or in Lotus, we also believe that the stomach, whatever you eat, your food is your medicine, and it could be your sickness also. So we focus on digestive issues. We focus on how the food that we recommend to you can help you to heal your body. So it's not just about taking a herb here or it's looking at your lifestyle at the beginning. How do you eat? Also, what do you think? How are you very stressed? How your mental health is, your spiritual, all these things, you know, like we need to make sure. And then we see what is the cause of the ailments you are having, okay? And going back to the treatments, we also combine a lot of types of massages. Some with oil, some is Ayurvedic massage, some is Japanese massage, something called shiatsu massage. So there are different types of massages targeted for different, whether for pain relief or for stress relief, you know. So these are all therapeutic massages that have been practiced long time ago.
So
Also
before you even go on, when you mention massages,
yeah.
now if you are practicing prophetic medicine, who does massage for who?
We have ladies who do for ladies and men who do for men.
I can't imagine a man lying on the stretch.
Well, some clients, they like it, but they ask for a male or a woman, but it's available.
Those ones, they have hidden motives.
Anyway, so when it's done professionally, there shouldn't be any issues with that because it's done for therapeutic reasons. And we also do cupping. The cupping, there is two types of cupping. One is the dry cupping, which is just a cup and then you draw the vacuum. But the most important treatment, which is a prophetic treatment as well, is called Hijamah. It's called wet cupping. This treatment is one of the maybe neglected sunnah that is very, very important because it's a very good procedure to relieve toxins from the body. Heavy metals, toxic blood. You know, the blood usually needs to regenerate and you know, renew itself. And then there's a lot of these dead cells remaining in the blood, in the body that accumulate the toxins in it. So Hijamah is a very important, maybe later doctor can explain more about it. It's a very important prophetic procedure that's recommended by Prophet Muhammad sallallahu alaihi wasallam for every person as a prevention and as a cure. It has cure for so many ailments. It's a very important, it's one of the most important.
I want to try one before Ramadan.
Please, you need to, because it's very important to do it before Ramadan.
I did the dry one.
No, you should do the wet one, the Hijamah.
No, yes, but I did the dry one sometime last year. But I think I have to try the wet one.
It has so many benefits,
and
actually.
then he told me a lot of changes that he experienced after that. But how effective are these treatments and therapies?
Actually, they are very effective. Why? Because they go with the natural way of the body, these traditional things. They understand the way the body functions. Let's, for example, when you are doing massages, you follow the blood circulation. You excite the specific points that are in the body that needs to be activated and improve the, you know, touching and especially when you are using oils. Rasulullah also said, "Kulu zayta wa dahinu bih." Eat the oil and apply it on your body. So applying oil on the body has a lot of benefits. So we see from our clients, they really experience a lot of, you know, stress relief, a lot of comfort. There are some pains in the muscles, and they don't go without proper massages. And regarding the Hijamah, it's been very proven. Even now, it's become a treatment in the UK. So what I wanted to comment on what doctor said before that, modern medicine, modern research and science has proven a lot of the things that Prophet Muhammad has recommended. One of it is the hijamah. Now is being practiced in the hospitals as a way of treating patients in the UK. And other also things like when we talk about black seed, when we talk about olive oil, when we talk all these things. Now there is science proving that all these things have very good effect on health. So as for effectiveness, they are very effective. They really work.
At the time, is always not a friend on this program. But before we go, I would like, I started this question, I mean, in a way, but I want you to answer it for me now, Dr. Muftawu. With Ramadan approaching, what advice do you give our cherished audience as they prepare for to fast in the month of Ramadan?
Yeah. I think the first advice is, since we are still in the month of Shawwal,
No.
try Shaban, try and then do one of the fasting that the Prophet recommend to test your health level.
Mondays,
Yes,
Thursdays,
Thursdays,
and then the white days.
the white days. You try and then do them so that you know your, as they say, your smoothness level.
Inshallah.
If you notice any excessive weakness or tiredness that is very unusual, you should understand that you have a problem and you need expert advice. Apart from that, we have people who are already having underlying conditions. There are people who are ulcer patients. We have people who are diabetic, who have high blood pressure, who are having cancer. All these people, you try and seek care as soon as possible. If you also happen to be the one who don't normally visit any health facility, you try and then do it. Don't think that I don't fall sick, so you can always be going around. Those kind of behaviors don't normally
Can be taken unaware.
Yes,
be
it doesn't
taken by
normally.
surprise.
Yes. And then we should know that religiously, we should also know that the fasting that we are doing, Allah subhanahu wa ta'ala is not benefiting from it anyway. It's for our own good. So we should pay attention to the benefit that Allah subhanahu wa ta'ala has promised us that we'll get, so that we'll be able to reform our characters as well.
Okay.
Inshallah.
Madam, I think that this, you need to come again so that we can talk proper and sit down and talk Lotus, Detox, and then Wellness Center proper. In other words, if we have a collaboration or some kind of sponsorship on our program, we'll be able to do a lot of things, even commercial. But let me understand from you, if somebody hears or watch this program and is interested in coming to know more about the therapies, where can you be located?
We are in Jawlu, not far, within the residential area, not far from Jawlu Special School. We have road signs there, and we are also on Google Map. If they want to Google us, they can also call us on 0557 558 917 to ask of directions and if they have any other questions. Yeah.
Okay, your final remarks.
Final remarks. My final remarks are: we are, as Muslims, if we know how to practice our religion and our fasting properly, our prayers very well, and we also seek healing in the Quran and in the zikr, I think we had an advantage, great advantage over, other people who don't have these teachings. So I encourage everyone to understand more the health benefits of these practices and apply them with concentration and with love to themselves, because this is very important. Allah has asked us to do all these things for our own good.
So, Dr. Muftawu, any takeaway for my audience?
Yeah, I think the takeaway let me use the opportunity to encourage people to keep their environment clean once we enter the fasting period. When you break your fast, the water or the banana that you eat, please don't throw it anyhow. Let's inculcate that good habit that the Prophet Muhammad sallallahu alaihi wasallam wants us to keep our environment clean, because that is one of the approach to good health. Yeah, I think that is what I can
Viewers, all too soon, we are coming to the end of today's edition of Islamic Belt. Anytime I listen to aspects on health, sometimes within me, I feel some kind of guilt. But if you know you have practicing, you have do some bad practices health-wise, or you know yourself. So I know there are people like me out there. So I'm hopeful that today's show will change or have effect on a lot of people. But if you want to know more, then like Madam had said, look for Lotus Detox and Wellness Center in Jolo. And you have time with Dr. Muftawu, Madam May, and then the Indian specialist and more. Until we come your way, same time next week with another interesting edition of Islamic Belt. I have been speaking to Dr. Muftawu Mohammed, natural therapist, and then from Lotus Detox. The Lotus is very hard on my list.
Really?
Yes, from Lotus Detox and Wellness Center.
Yes.
And then I also have Hajia or Madam May, who happens to be the CEO. Assalamu alaikum. My name is Abbas Umar Abdul Karim. Assalamu alaikum wa rahmatullahi wa barakatuh.